Hello, beautiful people. Welcome back to my space. Welcome back to Benita Fertility and Family Diary. Today, I want us to discuss another important test, which is HSG. Yes, especially if you've tried for 1 year and above and pregnancy didn't come. So I want us to talk about this part of the fertility investigation. I listed that if you've tried for 1 year and above and conception didn't come and you're above 35, it is important you undergo this test. Now, what is this HSG they are talking about? Is a special X-ray. Is a special X-ray procedure used to check the uterus and the fallopian tubes. During this procedure, a special dye is gently passed through the cervix into the uterus and the fallopian tube. X-ray images are then often taken to see if the dye flows free through the tubes. Now, let me talk about why is this HSG test important for my trying to conceive mothers. One of the most common reasons for infertility is blockage of fallopian tube. The fallopian tubes are the pathway that allow the sperm to meet the egg. If one tube or both are blocked, fertilization may not happen naturally. I repeat again, if one tube or both tubes are blocked, fertilization may not happen naturally. Do you understand? So an HSG test helps a doctor determine 1, if the fallopian tubes are open, 2, if one or both tubes are blocked, if there are abnormalities in the shape of the uterus, then and it also helps doctors to know the possible cause of the difficulty in getting pregnant. Now, who are the people that need this HSG? Okay, who may need an HSG test? Okay, your doctor may recommend an HSG test if you have tried for 12 months and above and conception didn't come. Then if you have had any history of pelvic infection, your doctor may request it. Then if you have had any previous pelvic surgery, your doctor may request it. Then if you have experienced recurrent miscarriage, your doctor may also request it. Then if there is any suspicion of blocked fallopian tube, your doctor could also request it. So fine. Now, so you see the people that might be needing it. Then now, does this test, some people say it's hot. Does it hurt? Yes, many women might experience a little mild cramping similar to menstrual cramp during the procedure. The discomfort is usually temporary and goes away shortly after the test has been carried out. Then now the question is, can you get pregnant after this HSG test has been carried out? Interestingly, some women become pregnant in a month just immediately after this test has been carried out. Yes, some women get pregnant after it immediately. We've had like 3 patients that got pregnant immediately after it. Yes, and this actually happens because the dye that can sometimes clear the minor blockage, that dye that is being used there most times, it helps to clear the minor blockage or debris within the tube. You see, so probably it helps them. However, this does not happen for every woman, but I said some women it does happen. So it is important you go for this HSG test. Let's know if the tubes are patent enough, if they are functioning very, very well. It is not a do or die affair. It is not a death sentence. It's just a little procedure that is very, very important, that can go a long way to help our trying to conceive mothers to get pregnant. Now, my final message to my trying to conceive moment: if your doctor recommends an HSG test for you, don't be afraid. It is an important investigation that helps determine whether your fallopian tubes are open and whether there may be any issue affecting your chances of conception. The earlier the better. Knowing the cause of your infertility is the first step towards finding the right treatment and moving closer to your dream of becoming a mother. So please, I want you to stay hopeful. I want you to stay informed. And I want you to remember that every fertility journey is unique. So I want you to stay hopeful, stay informed, and be happy. And please, if you found this video helpful, and if you're watching me from YouTube, I want you to subscribe, I want you to comment, I want you to like. And if you're watching me from Facebook, if you just pop up on your Facebook timeline and you're not following, please, I want you to follow Benita Fertility and Family Diary for more of your fertility talk. If you're trying to conceive, this our page can help you a lot. Thank you so much for watching. Bye bye, and please see you in my next video. Bye.